My name is Jacqueline Brooks. I am a retired school superintendent. I have 33 years of experience in education, and I currently work part-time for School Superintendents of Alabama.
Okay. Okay. So my first question for you is, what were your initial thoughts about COVID impacting your school system?
My initial thoughts were, what is this? It's something I have never seen before. We had no plans on how to deal with such an impactful communicable disease. And so my initial thoughts were to put my head together with the county sheriff, Sheriff Bronson, and let's go ahead and be prepared. And this was well before the month of March. So this was the end of January. I had been to a conference in California, and things had advanced far more aggressively in California than they had in Alabama. And he had gone to some type of briefing as well. So together, the two of us thought that this was going to get pretty big. So pre-planning was key, but we didn't know how and what to plan for really because there was no published guidance.
So did you and Sheriff Bronson have an initial response to COVID as you kind of figured it out?
We did. We had an initial response, and one of the things that we saw from the foreign countries was masking and hand sanitizing. And so we were fortunate to work with the local Roses when it was here, and the manager at General Dollar, Alice, when she was there to go ahead and get a number of supplies already in for his inmates at the jail and for the school children and the teachers in the school system. So before we kind of hit that supply chain shortage of PPE material, we already had some on hand. So I think that was one of the best planning moves we made.
Okay. And sort of as you went on and COVID progressed, how did you in the school, what was you guys' first response to the requirement of remote learning and just being virtual versus being in person and regularly attending?
Well, our first shutdown that came March 16th just left us helpless. I mean, we were just told to go home, and we stayed home from March 16th to April 6th. And during that time, of course, we had to come up with a COVID learning plan. And so we were fortunate in Macon County, even though we're a rural county, we're Black Belt, Alabama County,
Mm.
which is a high poverty rate. We were fortunate because in 2015 and again in 2019, we were recipients of the Apple Connect Ed grant, which had been a White House initiative under President Obama for connectivity and devices in school systems. So we had enough iPads for all of our students. So that part was great. And we already had a virtual platform called Acela. So that was pretty great. What we didn't have was connectivity throughout the county. So we had to move quickly to get our school buses wired. Luckily, there was some advance money, gears money from the feds to the governor's office and from the governor's office to the schools to do things like that. So we were able to get our school buses wired very quickly because we were already working with a company called Inside, and they had already put tracking software on our buses so we could know when buses made stops, if buses were driving too fast. And
Mhm.
so they were able to put a dual SIM card in our buses and allow it to toggle back and forth to find the best signal. So even in some of the most remote places, 95% of our kids had a signal, but of course the parents had to drive them to the church where the bus was parked or to the community center where the bus was parked. So it wasn't ideal, like having connectivity right in your own home so you could work any time of the day, but it was absolutely better than having nothing. Now,
Yeah.
the homes that had connectivity, that was great. Those kids were sailing, and so they had a distinct advantage. And so I still say today, because I don't think we've really made great improvements even since the pandemic in our state, in our community with connectivity. That's an essential technology. That's an essential utility now, just like water, lights, electricity. And so I wished everybody had access to it, and we certainly didn't at that time. We also purchased a number of hotspots, but just like a cell phone, if you don't have a cell phone signal in your community, you certainly don't have a hotspot signal.
Right.
So you still had bricked areas throughout the county where you couldn't connect.
Mm. Well, it sounds like you guys are really able to collaborate and handle some of those challenges, so that's really good. Do you think there was a difference in the students' learning capabilities versus remote learning and in person?
Oh, absolutely. Because in the situation where you may have had a parent with two, three, five, or eight kids in a home, you're talking about that number of kids trying to be on remote learning at one time. And if the parent is work, you have kids supervising kids. And so some kids are serious about their work even during normal school, and some aren't. So some were goofing off, some were playing, some wouldn't log on. So you had a myriad of things going. And the key thing is you had no home supervision in a lot of households, mine being one, because I was at work trying to make all this work. So I had a 16-year-old, well, at the time, a 14-year-old and a 7-year-old at home of my own, trying to make sure that they logged on. So I was depending on my 14-year-old to supervise my 7-year-old at home while she tried to do her work and he did his. Fortunately, they are both pretty calm kids and serious about their work, but that was not ideal for anyone. And so when you have even more than two kids or all the kids are young, I had an older one and a younger one, so it worked out. But in cases where you had all elementary school kids, that was really difficult. So some parents were trying to send their kids to some paid daycares that stayed open. And of course, kids were getting sick. It was very difficult for the daycare supervisor to try to manage all the connectivity and the devices. And so it was better than not having any learning, but it definitely was crisis learning.
Okay. And just a couple of more questions. How did the
Sure.
school system keep up with the changes in the CDC and the state of Alabama policies?
Oh my God. When I tell you we are so fortunate, we had a doctor in our community to volunteer to be our doctor of consult, and that's Dr. Dina Maxwell Stafford. She did webinars with our entire staff. She did webinars with our parents. Our nurse, our lead nurse, could go to Dr. Maxwell with any questions she had. She gave us advice. She was our advisor counselor through this whole process. We also had a direct link to Dr. Scott Harris in the Alabama Department of Public Health. We had probably weekly initially, then maybe bi-weekly webinars with him and our State Department. So we had direct links to the CDC at all times. And of course, the CDC website was very active and it stayed current.
That's good. I'm glad you guys were able to have that direct contact. So just so you could see firsthand some of the policies you were able to be following in your school system.
Absolutely. And so they would put out a guidance book specifically for schools about how far our seats should be apart, excuse me, social distancing on buses and all those kinds of things.
That's really good. Mm-hmm. And then my last question for you, I believe, is how are things now as COVID has progressed? It's kind of on the downside of it. How has your response changed, or how has the school's response changed versus the beginning when it was in the height of COVID?
Well, right now, of course, we don't identify close contacts anymore. We were sending a lot of people home before. This was a close contact. You sat by that person, you sneezed on that person. Basically, all of that is being held in abeyance now. We still in Macon County, which is one of a few counties, we still have a masking mandate in our schools because the city of Tuskegee still has a masking mandate. Not that people pay attention to it, but as a school agency under the auspices of the city, we have to follow city guidance. So we still have a mask mandate in our schools. We are also dealing with a trifecta because we have COVID, we have the flu. The flu was bigger than COVID this year for the school system. I mean, I think every kid had a touch of the flu at some point. And then we have the RSV, the respiratory virus going around. So we had a trifecta. We had several things going on, but they seem to be milder. It seems like immunity is better regarding those things. And basically, we do it on a case-by-case basis. If kids have to be out, we really enhanced our virtual platform. Every teacher was set up with a G Suite Google account. They were trained in Google Classroom, Google Meets, Google Notes, all kinds of things. So when a kid is out now, they just log onto the Google Classroom, get their work, and keep it moving.
All right. Well, thank you so much. It was really nice to hear from you. To you,
Oh, anytime, anytime.